So today we are discussing chronic disease and mental health, which is part of the way we live, the way we work, the way we develop and deal with that. So that means socially educated, we are not educated, talk about all the social determinants, whether we are women or men, whether children or adults, we are not exceptional of chronic condition and mental health. So universal approach, integrated remedies, comprehensive, timely approaches are needed into play. Who does this? All the stakeholders, families, communities, individuals are responsible.
Thank you. Okay, thank you very much. Thank you very much. I think you're very clear with the intersectionality approach when it comes to social determinants. Ephraim, as an African strategist, as someone who loves things at a continental level but with a connection to the global ground, what do you think is like a major challenge at the global level, and what can we do as civil society organizations, not for profit, but also not forgetting that some of the businesses are very supportive to create meaningful collaborations and partnership towards emulating at least getting into achieving half of the targets for the 2030 global goals. Thank you.
Thank you so much. In my opinion, I think issues to do with mental health and chronic illness, and I'll speak from the perspective of an African or Africa as a continent, they're still highly prejudiced. They're still highly it's not a common norm. It's not normal for somebody to admit to be going through anything, mental challenges. So before we even go to civil society organizations and global partners and partnerships in as far as mental health and chronic diseases is concerned, I think that as individuals, as Africans, as the continent, we must rise together and address why we are not addressing this as a continent. Why it's still criminal for you to be going through depression in a continent. Why it's still a shame for you to admit that I am struggling mentally. Why it is still prejudiced in societies. Why it is still being named or categorized in a satanic way or in a very not so welcoming manner. So as individuals, as people that have attended this conference, I task you, I task myself to go and be ambassadors at individual level. Be ambassadors to yourself first, be ambassadors to your communities, be ambassadors to everybody you talk about. It's not an issue to be embarrassed about, it's not an issue to be to prejudice somebody going through a very, very important issue like that. And then we can rally the civil society organization, we can rally the international partners, but from a global perspective, from a continental perspective, if we held hands together, if we understood and we brought ourselves to discussions like this, we opened our minds to the mindset that we know and we unlearn and we relearn some of these strategies, I believe we will have a better fighting chance as Africans and as civil societies and as people that are very happy to talk about some of these conversations, and it will give us more chances to share and be part of the discussion on the global scale. So for me, I believe you and I have a part to play, and we need to start now. Thank you.
Thank you very much. I love your passion that you have for Africa, but also the fact that you're very clear on the issue of mental health. Without going to the next panelist, this is an urgent action needed. Vehicle number DCVH 158 you're parked on a sidewalk and you're blocking others from moving out and coming in, please kindly help us to remove it. Thank you. DCVH 158, thank you. Let's continue with our conversation. Dr. Edward, what promising collaborations and partnerships are there promising in the health sector? The fact that you are an advocate for sickle cell, people living with sickle cells, but also you are a lived experience person. What are the opportunities associated with that of working together as a community, as organizations, moving forward from this conference? Thank you.
Yeah, I think there are a lot of good opportunities that exist for community organizations to partner together. Usually if you look at a family, that family could have hypertension in it could have diabetes in it, there's obesity within the same family. And so what we have to do is look at those challenges that exist in the community. As it was mentioned earlier about those social determinants of health, those social determinants of health can impact the whole family structure. It can prevent children from getting to school on time. It can prevent mothers from being able to get healthy foods, fruits and vegetables for their children and their family. It can prevent fathers from working in safe environments. So it's important that we come together as a community. So SCAGO, which as you mentioned address sickle cell disease, doesn't want to just look at, oh, well, sickle cell disease is our issue. We have to look at what are those issues that are affecting the whole family dynamic and then the whole community dynamic. And so by working with other organizations, we can identify, are those individuals getting good access to primary care? Do they have access to healthy fruits and vegetables outside of a convenience store or the fast food industry? Are we able to promote that walking or other environments that are safe? And so we have to look at how we build a wraparound service type of approach that is able to answer the whole family dynamic, not just looking at one aspect of the disease, but also how do we address all of those factors that have an impact on health, and that includes mental wellness as well. We realize that a lot of individuals may be from environments that don't have a long winter, they don't have to deal with the shorter days, and so how do we help those individuals to address those factors, looking at a whole systems approach?
Thank you very much, Dr. Livingston. I love the fact that you talk about eating healthy. For those who are not aware, if you go to City of Toronto website, there is what they call Black sovereignty. The good thing is that the government also understands this is a challenge when it comes to nutrition. There is a Black sovereignty that talks about factors that affect Black people when they come to Canada. First of all, the food issue is put as number one because it affects them mentally, because it lowers their iron and also weather itself. What challenges me is that it's already like a policy issue, it's known in the government, but the action is not there. Recently, I and my colleagues from Uganda, we came up with a policy. We are participating in a very competitive challenge here with the University of Toronto. And one of our ideas is to smart gardens within the city. And then one of the professors was asking why, how do we say smart? Because we are connecting it to food, nutrition, and climate action. Like hitting 8 sustainable goals in one action. That is our idea. And the professor is asking, because most of the food here is GMO, it's not organic. Organic food is very expensive. And we're trying to explain to them, if we come up with this idea, how it will be very important to the people of GTA, but also it can be scaled down to other communities. Things we think that can't be worked on can actually come up with the best solution. We told the professor, have you ever tried this challenge? He said no. So why do you think it doesn't work? Have you worked on this research? Have you worked on a research? He said no. So why do you think it doesn't work? And it's the reason we stayed in that challenge, because we want to show them that actually things can work out and there are other ways of doing it. And I hope if it works, people realize that they can have their small gardens within their balconies. Yeah, there are many things, there are many ways like to do things, and I love that you bring it up, but also this needs like corrective action. Thank you very much for being open about it, and I pray that we continue working together. So doctor, coming to you, I think these are two questions in one. What are those prevention strategies that have been put across globally, and because you gave a very interesting conversation, it was too wide, but in summary, what are those preventive strategies that have worked for the communities, and what do you think that needs to be done when it comes to policy level? Thank you.
Thank you. So the preventive strategies for chronic diseases that have worked elsewhere, number one is community engagement. Community engagement begins from individual, family, community, and going upwards. So many times policies have been made but have remained in the books, and they won't trickle down to the grassroots, the people who are being affected. So what I would like to see is that we engage the communities. And if you say we are doing the preventive, but we still have conversations whether we need bicycle lanes in the cities, then I don't understand what we're talking about. Because if you're encouraging people to be active, and you say, no, we are removing bicycle lanes to enlarge lanes for vehicles, then we are counteracting our activities. So my plea is that we engage the communities, and then we increase the funding for preventive measures, for preventive strategies, rather than having a big funding, which is statistically, and all studies show that we are funding, all governments are funding treatment. It's a lot of money, and less money is put in preventive strategies. Though on paper they can work, they are being put across, but we're not funding them to be put in action.
Just a minute before you continue, I just want to take you slightly back. You talked about if you're encouraging, it's about a policy issue, if you're encouraging people to use bicycles, at the same time you want to expand when it comes to an infrastructure program. On that note, what do you think, like you talked about community engagement and involvement, what do you think that is not being done? We as newcomers, we are newcomers, but we are the most affected because it's new culture and it's very shocking. Is there anything that we can do also to join the forces to the movement?
Thank you. So as someone who loves advocacy, I believe that we are here, and as we always recite in land acknowledgement, that this has become home. So since it has become home, we are living here, we are going to live here, our children are going to live here, our grandchildren are going to be here. So I want to call upon all the new immigrants to stand and to join the forces that are advocating for preventive measures, because you realize that we are coming to a different lifestyle. But where I come from, country I come from, it's kind of different. We can walk many times. We can use different ways of engaging in exercises. Some of us go to farming, we have gardens, we have farms, which is not here. So all this is taken away from us. We don't do it as exercise, but it's part of exercise. If you go to a garden, you have a hoe, you have a slasher, you have a panga, you are going to be there 3-4 hours, you are going to go to the bush with your cows, you have goats all around. All this is exercise. That you are different over in such a country where you're not engaging in this. So I want to call all the immigrants, all newcomers that come to Canada, to join the forces that are advocating for community engagement in the prevention of chronic diseases and the prevention of mental health issues. We need to join them, we need to come up and have one voice so that we can put up the government that yes, the policy may not be there, but not being implementing them. Here is what's on the ground. Thank you.
Thank you very much. I think that's very exhaustive because we are looking at the community interventions, and that brings us clear. Just before we go to the last round of questions, Julie, I think I had a conversation with you at lunchtime, and I was saying, with my knowledge, I don't know, maybe my professor or my doctor was not very knowledgeable on what I studied in school. But I remember in psychopathology, when it came to drug addiction and management, harm reduction, the way it's done home is done differently here. If I don't know, don't quote me wrong because we come from different schools and backgrounds. I know if someone has been taking 10 cigarettes, according to our approach we used to use, someone is taken to 9 until that person is used to 9 to 8. And it goes down. And I find the approach here totally different. What do you think about it? Is it the school of thought, or is it because of the culture where we are?
I think basically these are two different cultures, and the approaches are totally different. Understand? Like I was saying, instead of getting like Doctor was saying, the preventative, they are trying to engage in the outcome. You understand? So instead of implementing or making a strategic plan of how best to address, especially like I was talking about drug abuse, it's like it's being overlooked. It's being overlooked, and it's like, yes, they mention it on the news every day because I watch news every day, and they keep saying, you know what, it's 20 people die every day.
Like you know, watching news every day.
Every day I watch news to, local, and they always say, yeah, 20 people die every day. So what? What have you done? You understand? Like I was saying, because in the shelters and where it's like, they ask you, do you do this? Yeah, if you do it, yeah, when it's finished, you come and tell us, okay. Is that healthy? No, it's not healthy. So, like I was saying, we have to have an approach. For example, in Uganda, I always keep saying that music is the best way of communication. Why? Because if I had a song, if I wrote a song, of course songs, music is a story. If I wrote a song about COVID, for example, Bobby Wine sang a song during COVID, and everybody was reciting the song and singing to the song and trying to practice what he was talking about. Wash your hands, do this, do that, do that. So what we have to have here is the government to put in place strategies of how best to reach out to the populace effectively. Not just going on the news and saying, 20 people die every day. No, devise means of how best they can reach down to the grassroots. Can we get schools to write songs? Can we get schools to write poetry? Can we get schools to act? You understand? These I believe, especially the performing arts is the best method of conveying a message. Any message. Be it cancer, be it TB, be it AIDS, be it what. It is the best method. When Fide Bongole came, Lutaya sang about, today is me, tomorrow someone else. Everybody knows that song, and it's about AIDS. And he made the people learn and understand that AIDS is a reality. So we need such strategies, effective strategies, means of communication. So the approach has to change.
Yeah, thank you. Yes, I agree with you. The approach has to change, and whatever you have said is right. And I think you also agree with me that now this is a time for the new African Canadian that we need to now write a brief paper and to give it like City of Toronto and tell them they should not leave us behind when they are coming up with these policies, because we are the ones who are affected. They are not affected. They should construct. We should be part of the consultation to understand that the narrative they are using would not work for us, because we have our own way we tell our own story. All right, thank you very much.
Thank you.
My dear participants, we are coming to you as we go through the last round of questions, and I request that please say whatever is at your heart. Lastly, what do you think can be done? We are here because we said we are the community, we are the people to engage the policymakers, we have the families, we have friends, we have colleagues. What do you think that we need to do that has not been done? Just one, and then we move on, and then we go to our audience.
Okay, maybe for beginners, because we have very many shelters around, and like I said, once you check in, they ask you what to use. Do you use whatever, or you use alcohol, or you use whatever? So One thing they would do is to make sure that the social workers always have a program on a regular basis to have a client engagement and school them about drug abuse and school them about all the content and the disadvantages and the advantages. That is the basic. That should be the basic. Because it's cheap, I don't know how much it would cost, but anyway, they would be being paid salaries, and these would be part of their engagements as an outreach program to engage the clients in the shelters, basically. Because first of all, the challenge is coming to a new country, different culture, you don't have friends, you don't have family here, so people have resorted actually to drugs. So what should we do? Start with the shelters. Because I've seen the shelters around, in downtown. There's that place which is, oh God. So they need support. That is the grassroots. And it's the basic and quite affordable, I think.
Oh, okay, thank you very much. I love that, the outreach approach. Doctor, as you respond to this, please also respond on how we can reduce stigma. Just in 1 minute or 2 minutes, thank you.
Thank you. So, what should be done differently? I think source of information and the correct information, more so to the newcomers to Canada, need to be strategized and prioritized. Because there are a lot of challenges of getting access to health care, getting access to family physicians and primary care providers. So if people develop conditions or pre-developing conditions, or those who have come with conditions, they are going to worsen because it takes them long to access health services. And when it comes to landed migrants who come as PR holders, it becomes worse because it can take them even 6 months to get a health card. So in these 6 months, what is happening to these people who have just come into the country? So I think we need to put the information strictly across to the grassroots levels. People like where people land, whether shelters or airport and those sectors, need to have the information ready with these newcomers to this country to access this information, to be able to access the services and even preventive measures. Like you may want to say, I want to do a blood test for diabetes, a blood sugar test. Where do I need from? Where do I begin from? And it can take you 3 months to figure out where to begin from. So the information on ground need to be put across so that people can be able to access these services. Thank you.
Thank you very much. And we come to you, Dr. Edward. What do you think is can we do different to reduce stigma? Just in 1 minute.
Just so really quickly, we definitely have to figure out how to get the community and patient voice into our approach. As it was said earlier, we have to look at it as, hey, each individual is dealing with their own challenges. But how do we gather the voices of those individuals that are suffering so that policymakers can have that view of what's happening at the individual level to people? And so, when we look at things like depression or we look at things like mental health, each person is going through their own individual challenges, but we can figure out how to bring their voice into the discussion. So it's important to educate community members, but it's also important to listen to what they have to say and figure out how we incorporate their voice into the answer.
Thank you very much for being precise and concise. So the same question, what do you think? Just 1 minute? Yes, what can be done differently and what can we do to reduce the stigma? And I know you emphasized on it during your presentation, but there are some members who are not here, maybe they could get to know, only one is enough for them to take home.
Okay. Yeah, thank you so much. Once again, moderators asked me to talk about what can be done to reduce stigma. During my presentation, I talk about stigma around chronic diseases and mental health. and you know this is real. We are making a lot of judgment, but if you've been here, you've seen how people can get themselves into mental health and give up with life. So if you are not yet there, you can think you are strong, but when it comes and knock at your door, you now see the reality. So we don't need to be judgmental and stigmatize people because of their mental health status or their chronic diseases. That is one. Then stigma about probably immigrant. There's one thing that when I just came, the first person to interact with me told me, and I mastered it. The first thing in life is to keep positive. And actually, don't think that you are being stigmatized. You just play it cool, you just manage it. Move on, do the right thing. The right thing will put you in the foundation of what you need to do. I just want to add a little bit about what Julie said about reaching out to our new immigrant. I am bringing this to this flow that all of us are from out, and we have experienced this, we know. We are not going to sit and wait for the government to say, you are new immigrant, this is ABCD. I am saying, she has hit something very little, but if we look at it, there are people who can write projects around this area, identify where the new immigrants are. If you coordinate with the shelter management, you will be allowed to deliver information officially when the government knows that you are registered to receive new immigrants, and talk to them about this culture shock that they are likely to get into and how they should handle. Because now we who are already here have realized that the change of diet, the change of weather, the change of culture and everything is landing us into this giant chronic health problem and mental health. So we are not going to sit and cry. Let's do something about it, take to the table of the government and say, this is what we have experienced, and this is what our new people are likely to experience. We want to talk to them. We need ABCD, a go-ahead. A go-ahead is very important, then probably support. If you seek for support with a clear mind and a clear proposal, I guess it can be funded. So all of us should begin to think about how we're going to get out of all this so that we manage chronic disease and mental health that we're already in, because it is here to live and we're also here to live, so that we can live together with them. Thank you so much.
Okay, thank you very much. So you're calling upon anyone with a technical background in proposal development. I already have a group of young people who are here from Uganda.
I am advising. I am a writer myself.
Yes, so why don't we work
advising
together? We can work together. I think that's a meaningful collaboration that we are talking about.
Yeah,
thank you very much, Nancy. Now we get to our last panelist, and then we get to the audience.
Thank you. I just wanted to put something across. Romans 12:2 says, do not conform to the standards of this world. As an African, I want that to be at the back of your mind. You're in Canada, but you're African first. I'm going to ask you, and I'm going to say it again, do not conform to all the standards in Canada. And I say this very, very, very intentionally because there is so much that happens here, and there's so much, most of the systems here, unfortunately, enable And I will say this because, you know, most of the approaches, the harm reduction approach, most of them are quite enabling in a sense. So as an African, I'm going to ask you to sieve. Remember the African morals, remember where you're from, remember what has got us up until this point, and sieve through and see what works for you. You're not just going to pick everything and take it in, because what you put in is what's going to come out. Just sieve, tailor what works for you, and again, back to the issue of stigma. This is a very free country, non-judgmental country. Do not sit down, do not hold back, do not, just find a way, find your voice, find your own voice, find a way of standing for what you believe in, find a way of standing for what's right for you as an African, find a way of standing for what aligns with your goals, and I mean long-term goals in this sense. Otherwise, at the end of the day, I want to see you not conforming to the standards of Canada. Say it with me. I will not conform. I will not conform. Say it again. I will not conform, to the standards of this world. I will not conform, to the standards of Canada. And this goes for most of the things we're talking about. Mental health. As long as that's at the back of your mind, you will know where the gray areas are, you will leap beyond them. I know that you will make the right choices. I wish you all the very best. Thank you.
All right, thank you very much. Now we come to the... Thank you very much. We come to the audience. Please, this is your time to shine. When I was growing up, my aunt told me, once you're given an opportunity, make sure you use it. You never know someone who is next to you. He may be a donor, he may be an employer, he may be also a good Samaritan, but also your Santa may be seated next to you when you don't know. So speak up. It's our time to shine now, please. Yeah, thank you.
Thank you, everyone. My name is Joyce. Simply call me Joyce. So I have two very quick questions. I know you're experts up there, and I need your expertise. So my first question is, we are all Africans, and most of you are Ugandans. What is really mental health as opposed to psychiatry? Because to me, it is so confusing. I don't see the difference. How can you really define that? That is one. I want to ask my next question. My next question is about the injection sites. What do you have to say about these injection sites that are almost everywhere in every area in Toronto and outside Toronto? Thank you.
Thank you. You touched my heart by the first question. Yeah. And the second question, you just killed the lungs. Thank you. You can go on.
Okay. Hi, my name is Temple. I'm from Skego. I want to thank God for this kind of gathering. A lot has been learned. I want to thank the lady speaker there. In fact, a lot of reminders about home and here. In fact, this night I've cancelled my shift. I must shake my legs. Sometimes we are so busy with the shift that we forget these things that are very important. Thank you so much. I have a question for the first speaker. You said something, you were talking about the abuse and how to handle it. And most of the things you said are actually very, striking. But looking at the way it drives these organizations like these, the messages we pass across, do you think the government is towing the same line? I feel we are preaching a message that they are discouraging. I stand to be corrected. The effort being made to fight against drug abuse, is the government actually in line? Are they doing the same work like we're doing? That's on that. And then the speaker on the next, our doctor from Kenya, thank you so much. I also want to ask a question. For countries like this, back home, the impression we had about countries like this, in fact, we thought, there's no mistake, in places like Canada, US, everything is on point. why would they still be doing treatment instead of prevention? What could be the problem? I don't expect that kind of thing happening here, looking as in going, allowing things to destroy before they start fixing it. We were trying to learn from environments like this. What could be the problem? Why they still do the things, mistakes we make back home? Thank you.
Thank you very much. Ofri, you remember the questions? And any other person, or we first respond to these questions as we wait to... Any other question? Oh yeah, there is someone at the back.
Thank you everyone who is here. And I also like to thank the organizers of this event for coming up with such a nice theme, chronic illnesses. I came in a little bit late and I found Dr. Livingstone giving his presentation.